10 early signs of rheumatoid arthritis you must not ignore. It could save your life. Rheumatoid arthritis, RA, rarely announces itself loudly. Instead, it creeps in quietly, through morning stiffness that lingers, fingers that ache without reason, or a fatigue that feels heavier than usual. These early whispers are easy to brush aside, yet they may be the first signals of an autoimmune disease that doesn't just target your joints, but your entire body. Rheumatoid arthritis is far more than just arthritis. Left unchecked, it can affect your heart, lungs, eyes, and overall health. The good news? Catching it early can make all the difference, slowing its progression and protecting your quality of life. In this video, we'll uncover 10 early warning signs of rheumatoid arthritis you shouldn't ignore. Whether you're noticing subtle changes or simply want to stay ahead of your health, these are the clues your body may be sending before rheumatoid arthritis takes a firmer hold. Disclaimer: the information provided about rheumatoid arthritis, RA, is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider regarding any medical concerns or treatment decisions. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Morning stiffness. Imagine waking up and feeling like your joints have been frozen overnight. That's the reality for people experiencing one of the hallmark signs of rheumatoid arthritis, morning stiffness. This isn't the kind of stiffness that disappears after a few stretches. In RA, morning stiffness typically lasts more than 30 minutes, often exceeding an hour. In advanced disease, it can persist for several hours. Patients often describe it vividly, like being a rusty hinge that needs oiling or moving through thick mud. The hands and feet are usually hit hardest, though any joint can be affected. What makes this different from normal stiffness is how it improves with movement throughout the day. Here's what sets RA stiffness apart from other conditions. In osteoarthritis, morning stiffness rarely lasts longer than 30 minutes and resolves quickly with mild activity. Tendon problems typically cause stiffness related to overuse rather than rest. So when should you be concerned? If your morning stiffness consistently lasts more than 30 minutes, especially if accompanied by joint pain and swelling, it's time to see a doctor. Pay particular attention if this pattern continues for 2 to 3 weeks or longer. This duration is highly suggestive of inflammatory arthritis, not just normal wear and tear. Early evaluation by a specialist can make a significant difference in your long-term outcomes. Don't brush off persistent morning stiffness as just part of aging. Your joints are trying to tell you something important. 2. Joint swelling and warmth. Joint swelling in rheumatoid arthritis isn't subtle. It's one of the cardinal features that sets this condition apart. The affected areas become visibly puffy, soft to the touch, and often feel warm or even hot. You might notice your rings suddenly won't come off, or bending your fingers and wrists becomes difficult. This swelling has a distinct quality that doctors describe as boggy or spongy, quite different from other types of joint problems. In early stages, the swelling might be mild and intermittent. But over time, it becomes more persistent and spreads to involve multiple joints. The warmth you feel isn't just in your imagination, it's real inflammation at work. What makes RA swelling unique? In osteoarthritis, swelling tends to be bony and hard rather than soft. There's little heat or redness involved. Gout attacks joints with intense redness and swelling too, but it usually targets 1 or 2 joints at a time. RA typically affects multiple joints symmetrically, both wrists, both hands, both feet. Here's when you need to act. Persistent or recurrent swelling and warmth in multiple joints, especially if symmetrical, requires prompt medical assessment. Don't wait to see if it goes away on its own. Swelling that doesn't improve with rest is particularly concerning. If the swelling interferes with your daily activities, gripping a pen, opening jars, walking comfortably, you need evaluation. Early diagnosis and treatment can prevent permanent damage to your joints. 3. Fatigue and malaise. Up to 90% of rheumatoid arthritis patients report fatigue as one of their most disabling symptoms. But this isn't ordinary tiredness that a good night's sleep can fix. This is profound, bone-deep exhaustion that persists no matter how much you rest. Patients describe feeling heavy, like they're fighting the flu constantly, even when they're not sick. It's a general malaise, a pervasive sense of not being well. What makes RA fatigue particularly frustrating is its timing. It often appears before joint symptoms become obvious or intensifies during disease flares. You might find yourself struggling to concentrate, feeling depressed, or unable to complete tasks that were once simple. The emotional toll compounds the physical exhaustion. When fatigue interferes with work, relationships, and daily activities, it affects your entire quality of life. How is this different from other types of fatigue? Chronic fatigue syndrome and viral illnesses cause similar exhaustion, but RA typically comes with joint symptoms and measurable signs of systemic inflammation in blood tests. Sleep apnea, thyroid problems, or depression can also cause persistent tiredness. However, these conditions don't typically include joint swelling or pain as primary features. When should you seek help? If your fatigue persists despite adequate rest and sleep, it's time for evaluation, particularly if it's accompanied by joint pain, stiffness, or that general feeling of malaise. Don't let your doctor dismiss it as just stress or normal aging. Persistent, disabling fatigue alongside other symptoms deserves thorough investigation and appropriate treatment. 4. Rheumatoid nodules. Rheumatoid nodules are firm lumps that develop under the skin, typically over pressure points. You'll most commonly find them on elbows, fingers, the Achilles tendon, or forearms, anywhere the skin experiences repeated pressure or friction. These nodules range from pea-sized to as large as a walnut. They're usually painless or only slightly tender, but their presence carries important diagnostic information. About 20 to 40% of RA patients develop these nodules. They're more common in people with severe, long-standing disease or those who test positive for rheumatoid factor. Sometimes nodules appear alone, but often they occur in clusters. In rare cases, they can even form inside the body, in the lungs, heart, or eyes. What else could these lumps be? Gouty tophi are nodular deposits of uric acid crystals that can look similar, but they occur in a different disease context. Lipomas are soft, fatty lumps that move easily under the skin. Ganglion cysts, often found near joints, are fluid-filled rather than solid. Rheumatic fever can cause nodules, but this is rare in adults and more transient than RA nodules. Here's why nodules matter. Their appearance, especially with joint symptoms, signals that you need rheumatology evaluation promptly. Nodules indicate more aggressive disease and potential extra-articular involvement affecting organs beyond the joints. Treatment may need to be modified or intensified. If nodules ulcerate, become infected, or interfere with function, like making it hard to write or walk, surgical removal might be necessary. 5. Low-grade fever and weight loss. Rheumatoid arthritis isn't just about joints. It's a systemic inflammatory disease that affects your entire body. This explains why many patients experience persistent low-grade fever, typically ranging from 100 to 101 degrees Fahrenheit. The fever may be more noticeable during disease flares when inflammation is particularly active. But here's what's tricky. If you have RA and develop a fever, it's crucial to determine whether it's from the disease or a concurrent infection. This is especially important for patients taking immunosuppressive medications, which increase infection risk. Weight loss often accompanies the fever and inflammation. It's not intentional. It happens because chronic inflammation revs up your metabolism, reduces appetite, and sometimes medication side effects contribute. What else could cause these symptoms? Infections, cancers, and other autoimmune disorders like lupus can present similarly. The key difference is that infection-related fever is usually higher grade and more acute. You might experience chills, specific localized symptoms like cough or urinary burning, and the onset is typically sudden rather than gradual. When do you need medical attention? Any persistent fever in someone with RA requires prompt evaluation. Don't assume it's just a flare. It could be a serious infection requiring immediate treatment. Unexplained, significant weight loss is a red flag that demands thorough investigation. While some weight loss might result from RA inflammation, dramatic weight loss could indicate underlying malignancy or other serious systemic disease. Never ignore these constitutional symptoms. They provide important clues about what's happening inside your body beyond the joints. 6. Reduced range of motion. One of the most life-altering aspects of rheumatoid arthritis is how it gradually steals your ability to move freely. Reduced range of motion and functional impairment don't happen overnight. They creep up slowly, robbing you of independence. You might first notice difficulty with seemingly simple tasks. Stretching to reach a high shelf, bending to tie your shoes, grasping a door handle, or walking without discomfort become increasingly challenging. In early disease, the limitation is primarily due to pain. Your joints can still move, but it hurts too much to use them fully. With chronic disease, the picture changes dramatically. Synovial tissue invades the joint space, cartilage deteriorates, and ligaments get destroyed. This leads to mechanical damage that creates lasting stiffness and genuine loss of motion. Advanced RA can result in fixed deformities where joints literally can't move anymore, causing profound disability. How is this different from other conditions? Osteoarthritis typically causes localized loss of motion in specific joints you've overused. Neurologic conditions cause weakness, not true joint stiffness. You can't generate the muscle force to move, but the joint itself isn't restricted. Fibromyalgia affects muscle function and causes widespread pain, but it doesn't actually limit joint mobility mechanically. What should you do? New or worsening functional limitations, especially if they're progressive, need evaluation. Don't accept disability as inevitable. Range of motion exercises, occupational therapy, physical therapy, and appropriate drug treatment are vital to preserve joint function. Early intervention can prevent permanent limitations that drastically impact your quality of life. 7. Numbness and tingling. Up to 40% of people with rheumatoid arthritis develop neuropathy, nerve damage that causes numbness, tingling, burning sensations, or weakness. The hands and feet are most commonly affected, with carpal tunnel syndrome being particularly frequent. Patients describe it as pins and needles, numbness that makes it hard to feel objects, burning pain, or weakness that makes gripping difficult. What causes this nerve involvement? There are several mechanisms at play. Joint swelling can compress nerves directly. The median nerve at the wrist is especially vulnerable. Inflammation from RA can attack nerves themselves through a process called vasculitis, where blood vessel inflammation cuts off nerve blood supply. Sometimes medications used to treat RA, particularly TNF blockers, can contribute to neuropathy. Advanced rheumatoid arthritis can cause severe neuropathic pain and profound sensory loss. You might not feel injuries, temperature changes, or pressure, creating safety risks like burns or wounds you don't notice. How do you distinguish RA neuropathy from other causes? Carpal tunnel syndrome can certainly occur independently of RA, affecting people who do repetitive hand movements. But in RA patients, symptoms are often more symmetrical, both hands affected similarly, and occur alongside other RA features. Diabetic neuropathy, vitamin B12 deficiency, and lumbar spine problems causing nerve root compression are other possibilities to consider. When should you see a doctor? New onset or worsening numbness, tingling, or weakness requires prompt assessment, especially if it interferes with movement or accompanies other warning signs. Early detection of nerve compression or inflammation allows intervention before permanent nerve damage occurs. 8. Dryness and ocular/oral involvement. Up to 30% of people with rheumatoid arthritis develop secondary Sjogren's syndrome, an autoimmune condition that targets moisture-producing glands. The result is persistent, uncomfortable dryness affecting multiple body systems. The most common symptoms are dry mouth, called xerostomia, and dry eyes, known as keratoconjunctivitis sicca. Your eyes might feel gritty, burning, or like there's sand in them. Your mouth becomes so dry that swallowing, speaking, or even wearing dentures becomes difficult. This isn't minor discomfort. Dry mouth increases your risk of dental cavities, gum disease, and oral infections like thrush. Dry eyes can progress to corneal ulceration or serious eye infections that threaten vision. Some patients also experience vaginal dryness or skin problems. What starts as mild annoyance can progress to significant disability and medical complications. How do you know it's autoimmune rather than something else? Many medications cause dryness as a side effect: antihistamines, antidepressants, blood pressure medications. But medication-related dryness is typically less severe. True autoimmune sicca is persistent and usually associated with positive autoantibodies in blood tests. Primary Sjogren's syndrome occurs without RA or other autoimmune diseases. Normal aging can cause some dryness, but not the severe, persistent symptoms seen in autoimmune disease. When should you seek evaluation? Persistent eye or mouth dryness, particularly in someone with joint symptoms or diagnosed RA, requires further investigation. Testing for secondary Sjogren's syndrome is important because the condition carries risks beyond discomfort. Proper management requires coordination between rheumatology, ophthalmology, and dentistry. There's also an increased lymphoma risk that requires monitoring. 9. Joint deformities in advanced RA. When rheumatoid arthritis goes untreated or becomes severe, permanent changes in joint shape and function can occur. These deformities represent the devastating endpoint of chronic inflammation, visible evidence of irreversible damage. The hands often show the most dramatic changes. Ulnar deviation occurs when fingers drift toward the pinky side at the knuckles. Boutonniere deformity causes the middle finger joint to bend downward while the tip bends upward. Swan neck deformity is the opposite pattern. The middle joint hyperextends while the tip bends down. Z deformity, or hitchhiker's thumb, causes the thumb to develop a characteristic zigzag appearance. The feet suffer too, developing claw toes, hammer toes, bunions, and collapsed arches that make walking painful. What makes these deformities particularly characteristic is their symmetry. Both hands, both feet, affected similarly, a hallmark of RA. The underlying cause is chronic synovial inflammation that literally eats away at bone, causing erosions. Tendons rupture from inflammation and mechanical stress. Ligaments become lax and can no longer hold joints in proper alignment. The result can be joint fusion, dislocation, or instability that dramatically impairs hand and foot function. How is this different from other arthritis? Osteoarthritis causes bony swellings called Heberdens and Bouchard's nodes and gradual joint changes, but rarely produces these dramatic, symmetrical deformities. Post-traumatic arthritis and congenital hand or foot problems are typically isolated to specific areas. What's the message here? New deformity or loss of joint alignment is an urgent sign of disease progression. Early, aggressive treatment can prevent these changes entirely. 10. Cognitive and emotional impact. RA doesn't just affect the body, it weighs heavily on the mind. Chronic pain, fatigue, and physical limitations can lead to emotional distress. Many patients report feeling anxious, depressed, or mentally foggy, especially during flares. This mental strain isn't just a reaction to discomfort. Inflammation itself can affect brain chemistry, leading to mood changes and difficulty concentrating. Patients may struggle with memory, decision-making, or staying focused on tasks. The emotional toll of RA can be profound. Losing independence, facing unpredictable symptoms, and managing long-term treatment all contribute to psychological stress. It's not uncommon for patients to feel isolated or overwhelmed. Unlike depression or anxiety alone, RA-related emotional symptoms often come with physical signs, joint pain, fatigue, and systemic inflammation. That combination helps distinguish RA from purely mental health conditions. If you're feeling persistently down, anxious, or mentally foggy, and you also have joint symptoms, it's time to speak up. These aren't just side effects, they're part of the disease. Mental health support is a vital part of RA care. Treatment may include counseling, medication, and lifestyle changes. Addressing emotional health can improve physical outcomes too. A holistic approach, treating both body and mind, is essential for managing RA effectively. Subscribe to the Human Health YouTube channel for more insights. If you found this content helpful, please like, share, and comment below.